Hi everyone, my name is Angela, and welcome to my presentation on the impact and perceptions of continued medical education opportunities among clinicians in rural Ghana. And this is a quality improvement project of a virtual Grand Rounds program that was launched by the international medical charity Ghana Medical Help, for which I volunteer. So our objectives for today's presentation is to give a brief overview as to why this program was launched to begin with and the motivation behind it. So we'll go over the need for continued medical education in rural Ghana. I'll give a quick description of the virtual Grand Rounds program that we launched. We'll go over some preliminary results and findings, and then some future directions for the project. So continuing medical education, which I will refer to as CME moving forward, refers to a specific form of postgraduate education that helps those in the medical field maintain competence and learn about new and developing areas in their field. And the World Health Organization has identified CME to be one of the most important elements in improving healthcare workers' skills, knowledge, and morale. However, CME opportunities are quite scarce for clinicians in rural Ghana, which hinders their ability to remain up to date on recent evidence-based practices. This all contributes to low morale, low clinical competence, and challenges in recruiting and retaining healthcare workers, which then further reinforces health disparities in low-resource communities, such as rural Ghana. So the pilot virtual Grand Rounds program was launched in July of 2021 with the goal of addressing this gap in access to CME and improve access to these sorts of opportunities for rural health workers in northern Ghana. So the virtual Grand Rounds program are essentially weekly presentations where a Ghanaian physician will present on a medical topic that they have expertise in. So here these little posters are examples of past presentations. So we have sickle cell disease, peripartum cardiomyopathy, pulmonary tuberculosis, and infective endocarditis as a few examples. So the data that I'll be sharing with you today come from 9 virtual Grand Round seminars, which were conducted between January and April of 2022. So what we did was we sent out an online semi-quantitative Qualtrics survey out after each presentation, and the survey included 5 demographic questions, which included things like age, gender, occupation. There were also 5 5-point Likert scale presentation evaluation questions, where participants were asked to evaluate the presentation they just watched, and I'll go into what those questions were in the results section. There were also 3 open-ended feedback questions, where we asked participants to freely share how they had benefited from the program and what sorts of future topics that they would like to see as part of the virtual Grand Rounds presentations. So here are some of our demographic data that we collected from the surveys. So in the top left, you can see the age distribution of participants. So the vast majority of our attendees fell in the 25 to 45 age range. Then in the top right, you can see their field of work. So about 46% of the attendees were physicians, about 11% students. Nurses made up about 16%, 12% were physician assistants, and then 15% fell under this other category, which largely included pharmacists and midwives. Then the gender distribution of our participants, you can see in the bottom right. So about 78% of the attendees were male and about 22% female. And then in the bottom left, we asked a question about how many seminars they had attended up to that point. And the majority had attended about 2 to 5, and the others either more or less. So here are the results from the presentation-specific evaluation questions, which were based on the 5-point Likert scale. So participants were asked how strongly they agree or disagree with the 5 statements listed below. So it could range anywhere from strongly disagree, neutral, agree, or strongly agree. And the 5 statements were: I have applied what I learned from past presentations in my clinical practice. I will use what I learned from today's presentation in my clinical practice. I would attend future grand rounds presentations. Today's presentation was interactive, and today's presentation was helpful and relevant for my clinical practice. So as you can see, the vast majority of participants strongly agreed with all of the statements, which gave us an early indication that the program was benefiting a lot of the participants. And I'll also mention that the sample size for each of these questions varies a little bit. So for the bottom 2, it was about 234 surveys that contained this question. But in future iterations of the survey, we scrapped some questions while we were experimenting. So the sample size for the first 3 questions is about 173. We have since finalized the survey, so hopefully we'll have some more kind of stable data in future presentations. So this is one of the tables from our manuscript, and it outlines some of the data we collected from one of the open-ended feedback questions, which asked respondents how they had benefited from the community service agenda presentations. And I'll clarify here that the virtual Grand Rounds program is locally known as the community service agenda, which is why the question was phrased in this way. But 3 major themes came from the analysis of this question. So the first one was increased or updated knowledge, and about 67% of respondents to this question, or 37 individuals, gave comments along the lines of increased knowledge. So example quotes are found on the right-hand column. So for example, one participant said, "It has been very helpful in improvement of my knowledge base, keeping me up to date with current trends in common case management." Another theme that came about was the application of knowledge and improved clinical performance, and this was about 14% of the respondents to this question. So one participant said, "It has improved my clinical assessment and management of patients." And then the third theme, which was about 18% of participants or respondents to the question, gave generalized positive comments about the program. So example quote was, "Detailed topics with current management updates on all the topics discussed. This is the best thing to happen to us doctors in rural Ghana." So these are just some examples of some of the data we collected from the open-ended feedback questions. So now for a brief discussion of some of the early data we've collected from the virtual Grand Rounds program. So overall, the program is very feasible, it's quite cost-effective, and it has been well received by participants. Some benefits of the virtual format is that it has enabled attendance from health workers who would have otherwise been limited by poor road infrastructure and rainy season weather. We've also recently started recording the presentations and posting them on our YouTube channel so that participants who can't attend live can go back and watch the recordings later. Some early benefits we've been seeing from the program are improved clinical competency and morale, as well as improved recruitment of rural physicians to northern Ghana. So when the program was first launched in July of 2021, there were only 5 physicians in the Upper West Regional Hospital where this program is based out of, and this hospital supports a population of 868,000 people. As of July 2022, that number of physicians has over quadrupled, and nearly all attend the weekly Grand Rounds presentations. These new physicians have reported that they would have previously rejected northern job postings, but accepted it solely because of the ongoing learning opportunities that have now been offered, such as the weekly Grand Rounds program. The program has also provided mentorship opportunities for young physicians and medical students to connect with other like-minded individuals. So to wrap things up, I'll just go over some recent accomplishments and future directions of the program. So the Ministry of Health in Ghana recently approved the virtual Grand Rounds program for certified CME accreditation. We've also expanded our medical education program to include annual BLS and CPR training workshops. We've also been continuing with data collection, and recent iterations of the survey include additional variables, so we could add some depth and breadth to a future analysis of this program. Feel free to contact me if you have any questions or comments about the presentation or the program.